Welcome to Unit 6 Journal, MN662. So, I want to talk about a patient that I seen. And this young lady, she was young, she was 20 years old, and she had bipolar 1. She had been waiting for a while to see the doctor and the the psychologist. And she was just very impatient, irritable. I spoke with her, and she was just telling me that lately she was feeling more anxious. She would find herself pacing around her apartment. She was feeling depressed, and she said that's when she knew that her bipolar and manic was kicking in, because she's not a depressed person, but she had been feeling depressed. And so she came into the office. She said she had control of her manic intuition, her manic thoughts. For example, she said she had to talk herself out of spending like $1,000 on something, and she had to stop herself from uh, going out and walking, taking a walk at after midnight or whatnot. So the impulsive thing, she said she could like kind of control, but she just, the anxiety and the depression was bothering her. And um, so I had just was listening to an audio lecture about bipolar and borderline borderline and bipolar. And so it was just a coincidence that when I went into the clinic that we actually had a bipolar patient who was irritable. So, you know, she was on lithium, 450 milligrams, and her levels were at a therapeutic level in which we did not want to increase the lithium. So we were thinking to give her something for the depression. So when we went back into the room, she was very upset. She was, started yelling, like, I've been here or whatnot. And when we brought up depression again, she was like, I don't have depression. What are you talking about? I'm having depression. Um, I'm not a depressed person. I just want something for my anxiety. And so, you, at that moment, I was thinking, like, wow, this is what bipolar 1 looks like. Um, and I felt myself, like my heart was like racing, like I had a little anxiety. So I guess I would have to learn how to control those feelings when a patient gets irate or irritable or whatnot. I have to learn to control those feelings. Um, and so I try to basically, as the patient provider relationship, you don't want to just, and as a professional, you don't want to just end the, tell her to leave because she's irate or upset. You have to try to calm the patient down. And so I just, I was the first person who went in and seen her. And I was just talking to her, and I said, are you irritable now? Is this the irritability that you were talking about? Just trying to talk to her and calm her down. And uh, therapeutic use of self or whatnot. I didn't want to judge her, or no one wanted to say, hey, can you lower your voice or whatnot. You understand, once you understand what it means to be bipolar, then you can understand why she was acting the way she was, or whatnot. And not to mention, she was waiting in the office, in the room for so long. Um, so what I basically learned is basically I seen firsthand how a bipolar patient can react, and how their moods can go from, calm or anxious to irritable to upset or whatnot. And I also learned that I have to learn to control my inner feelings or whatnot. It was weird that I was like, okay, because I didn't know what was next. I think that's where my little anxiety came in. I didn't know what was next or how the patient would respond. So me as a psychiatric mental health nurse practitioner, I have to learn to regulate those emotions, I guess, because the doctor, he was seemed unbothered. And so I just love the way he, another thing that you have to be prepared for is you may, before you go in a room after collaborating, you may have a drug choice for the patient. But so when we went in the room, we had a drug choice for her, and it was to treat the depression that had surfaced because the bipolar. It's depression, and it's euphoria or whatnot, and she was in a depression state, so she wasn't understanding. We weren't saying she was a depressed person, but I guess that's what she thought we were saying, that she was a depressed person, but that's not what we were saying. And so she's like, I don't want anything for depression. I just want something for my anxiety. So I guess a learning point from that is to make sure you have a few different treatment plans for a patient. If you haven't been in this for a while and you don't want to step out the room like, okay, I'll be back. You don't want anything for depression. Let me figure something out for you. You have to have those different therapies in your head and ready to give the patient. And so just like this, the doctor just changed, and he said, okay, let's give you something for Seroquel, because give you some Seroquel because she did have problems sleeping. So he was saying that the Seroquel will help the anxiety and also the sleeping, and maybe it'll calm her down enough for her to come back, and maybe she won't be in an irritable state of mind, and we can actually talk to her and come up with a better plan if the Seroquel do not do the job. Sorry it's a little over, and thank you for listening.